Salt-restricted diets are often recommended to reduce blood pressure, support cardiovascular health, and lower the risk of heart disease, particularly in populations prone to hypertension. Reducing sodium intake is a cornerstone of many public health initiatives and clinical guidelines. However, emerging research is revealing that in certain populations, aggressive sodium restriction may have unintended consequences on glucose metabolism, potentially increasing insulin resistance. While this may sound concerning, understanding the underlying biology provides important context and highlights ways to balance sodium intake for optimal cardiovascular and metabolic health, emphasizing the adaptability of the body and the potential for individualized nutrition strategies. At the core of this effect is the interplay between sodium levels and the body's hormonal regulation of fluid balance, particularly through the renin-angiotensin-aldosterone system, RAS. When sodium intake drops significantly, the kidneys sense lower sodium availability and respond by increasing renin secretion, which in turn raises angiotensin II levels. Angiotensin II stimulates aldosterone production from the adrenal glands, promoting sodium retention and maintaining blood pressure. While this system is essential for homeostasis, chronically elevated aldosterone has been associated with impaired insulin signaling. Studies suggest that high aldosterone levels can reduce insulin-mediated glucose uptake in skeletal muscle and adipose tissue, contributing to higher circulating glucose levels and a degree of insulin resistance. In other words, the body's compensatory hormonal response to low sodium can inadvertently influence metabolic regulation, illustrating the delicate balance between cardiovascular and glucose homeostasis. Additional mechanisms may involve sympathetic nervous system activation. Sodium restriction can trigger mild increases in catecholamines, such as norepinephrine, which influence both blood pressure and glucose metabolism. Elevated catecholamines can decrease insulin sensitivity in peripheral tissues and increase hepatic glucose production. This physiological response is particularly pronounced in certain populations, such as individuals with obesity, metabolic syndrome, or pre-existing insulin resistance, where the compensatory hormonal and neural responses to low sodium may exacerbate metabolic challenges. Despite this, it is important to recognize that these effects are not universal, and many individuals maintain normal insulin sensitivity even on low-sodium diets, highlighting the importance of individualized approaches rather than one-size-fits-all recommendations. Research in both animal models and human trials has illuminated the nuanced effects of sodium restriction on glucose metabolism. In controlled studies, individuals placed on very low sodium diets sometimes exhibited elevated fasting insulin levels and reduced insulin sensitivity, while moderate sodium reduction did not produce the same effect. Animal studies have further demonstrated that severe sodium restriction can impair glucose tolerance and alter pancreatic beta cell function, but these effects were reversible when sodium intake returned to moderate levels. This reversibility is an encouraging finding, indicating that the body can recalibrate its hormonal and metabolic systems once sodium intake is optimized, and that insulin resistance is not necessarily a permanent consequence of a temporary dietary adjustment. The positive takeaway from these findings is that sodium reduction remains a beneficial strategy for cardiovascular health, particularly in individuals with high blood pressure, but it may need to be balanced with metabolic considerations. Moderate sodium restriction, rather than extreme limitation, appears sufficient to achieve reductions in blood pressure while minimizing compensatory hormonal activation that can impair glucose metabolism. Furthermore, pairing sodium reduction with diets rich in potassium, magnesium, fiber, and plant-based nutrients can support both vascular and metabolic health. Foods such as fruits, vegetables, legumes, and whole grains provide minerals that help regulate blood pressure, improve endothelial function, and support insulin sensitivity, creating a synergistic environment that mitigates potential negative effects of sodium restriction. Lifestyle factors also modulate the impact of sodium on insulin sensitivity. Regular physical activity enhances glucose uptake in skeletal muscle independent of insulin, improves vascular health, and can offset some of the compensatory hormonal changes associated with low sodium intake. Adequate protein intake, balanced macronutrients, and weight management further support metabolic resilience. By approaching sodium restriction as part of a broader lifestyle strategy, individuals can reap cardiovascular benefits while preserving optimal glucose regulation. This emphasizes the positive perspective. Rather than avoiding sodium reduction entirely, thoughtful dietary planning allows individuals to achieve multiple health goals simultaneously. Another encouraging aspect is the body's remarkable adaptability. Sodium requirements are not fixed and vary based on age, activity level, climate, and underlying health conditions. For physically active individuals or those who sweat heavily, slightly higher sodium intake may be appropriate to maintain electrolyte balance without compromising metabolic health. Conversely, in sedentary populations with elevated blood pressure, moderate sodium reduction can deliver cardiovascular benefits while carefully monitoring glucose parameters. This adaptability highlights that personalized nutrition strategies, rather than rigid rules, are the most effective way to optimize both cardiovascular and metabolic outcomes. In conclusion, research suggesting that salt-restricted diets might increase insulin resistance in certain populations underscores the complex interplay between sodium, adrenal hormones, sympathetic activity, and glucose metabolism. While compensatory mechanisms such as elevated aldosterone and catecholamine activity can impair insulin sensitivity in some individuals, these effects are generally reversible, context-dependent, and modifiable through moderate sodium reduction, balanced nutrient intake, and supportive lifestyle practices. The positive perspective is that sodium management remains a powerful tool for cardiovascular health, and when integrated thoughtfully with diet, physical activity, and individualized monitoring, it can support both healthy blood pressure and optimal glucose regulation. By understanding the mechanisms at play, individuals can make informed choices, optimize their dietary patterns, and maintain the delicate balance between cardiovascular and metabolic health, demonstrating the body's remarkable capacity for adaptation and resilience.